have been actually surprised by this pandemic. It shows that any system could have gaps. And we should have the humility to see to what extent our system is prepared and where are the gaps and how can we improve it for the future. I think from this pandemic, we have to try to learn, focus on learning what the gaps are. This is not a message only for the developing world. This is a message even for the developed countries. Across the board, you see lack of preparedness of the public health system. And of course, the whole health system. And that's why WHO has been advocating for universal health coverage, health for all, strong health systems, and with a strong foundation of primary health care. And within that, strong preparedness, especially in public health, to prevent outbreaks. That's the best, actually, the best option. And if it happens, to diagnose early and respond quickly and arrest it as quickly as possible. But we can see now, through this pandemic, there is a serious challenge or vulnerability even in countries who claim to have the strongest health system. I think this should bring humility to all our countries and see and assess the situation carefully, understand the gaps carefully, and understand the importance of health for all. We should not go into the cycle of panic and neglect. As you all know, we are now in a phase of panic because there is this dangerous, invisible virus which is wreaking havoc, and there is panic, and there is concern, but that should actually lead into asking questions on what to do to strengthen our system and to improve or reduce the vulnerabilities that we have. So the risk which is coming to our health professionals is because of weak health system. The reason why we're not detecting or preventing the outbreak easily or quickly is because of weak health system, because of serious vulnerability. And I don't think there is, from what we have seen now, no country is immune. No country can claim that it has a strong public health system or a strong health system. So we have to really be honest and assess and address this problem to provide better services to our people, but at the same time to protect our health professionals too.
Thank you very much. Next question comes from Brazil, Ana Pinto. Ms. Pinto, can you hear us?
Oh, yes. Oh.
Yes, please go ahead.
I can hear. Can you hear? Okay. Fine. Yeah. So it seems there seems to be a lack of coordination in some countries in terms of data collection and also lack of transparency when informing figures. In Brazil, for instance, studies have been indicating that numbers may be underreported. I would like to know if WHO is tracking those problems, and if so, what can be said about the quality of data in Brazil? And since quality data is crucial to formulate the right policies, what could be done to tackle underreporting data in such countries in the world? Thank you very much.
Thank you for the question. I think all countries around the world have experienced some difficulties in coordination, and particularly at subnational level, particularly in large countries with federated states. And there have been issues, obviously, between countries, especially neighbouring countries, in trying to work together to coordinate and align their activities. In fact, that's been a feature of this response, is that trying to get that international alignment, regional alignment, national alignment, subnational alignment of all of the activities with all of the actors and the players involved, in that sense, has been a huge challenge to governance at every level. I've often been asked, what are the most important things in epidemic response, and people expect me to say diagnostics or epidemiologists, and I usually say three things: governance, governance, and governance. I mean, at the heart of epidemic or emergency response is a need for coherence, for coordination, for alignment, for compromise. And sometimes compromise with people whom you might never compromise in any other circumstance. A partnership with people you might never work with in any other circumstance, because the goal goes higher. The goal is to go beyond the differences, to put aside differences and work together. That is difficult to do, but in a true emergency, that is what we all do. And I think that's something that all countries have experienced at one level or another. Some are overcoming that more successfully than others. But it is something that must be done if we're to get to the end of this epidemic. In terms of numbers, and I think sometimes we say, well, there's a lack of numbers or a lack of transparency. I think the first thing in all countries we need to recognise is that frontline health systems are under huge pressure. And therefore, reporting data isn't necessarily their first priority. If I'm a doctor or a nurse on the front line, I really don't think I've done a bad job if I save a life and I haven't filled in the form. And therefore, I think we have to give local systems a break. We have to empower them to be able to report into the system, but we shouldn't be criticising them when they don't, and it's the same at all levels of the system. We need to just make sure there's enough data to make a proper assessment of the situation. If there are large gaps, geographic gaps in the data, that's a problem. If there are large gaps around certain communities, if there are gaps around certain vulnerable communities, and that's a vacuum, then that's a bad thing. But I think just harping on the daily numbers, it's very difficult. We need to look at each of the data. Are we gathering enough data on the clinical disease? Are we gathering enough data on fatality? Are we missing large pockets of deaths? Are we missing large pockets of cases? Is there something else we need in order to plan a better response? If the answer to that is yes, then you have a data problem. But if it's coming down to you got it wrong yesterday by one case, or you got it wrong yesterday by 2 deaths, then it becomes very pedantic. It becomes very unhelpful, and these become political bullets that are fired between different groups. I think we have to be very, very careful to not do that. So we need to regularly review the data we're using to drive the response at each level. And if that data is either not being collected or not being sent, we have to fix that problem. But we don't need every single piece of data at every level to manage outbreaks. In fact, you need less data at higher levels. You need the most data at the local level. You need less data at the national level, and even less data at the international level. In fact, data can be your worst enemy in some cases, because you can become overloaded with data and become information poor. You're data rich, information poor, if you don't know what to do with that data. So it's a complex issue. Countries need to focus on collecting the data they need, and more importantly, using that data, putting it to good use, and using that data to drive the response. With regard to cohesion at country level, it is a huge test. Epidemics are a stress test to our system, and they stress every component of our society. And governance is tested in the same way as social systems are tested, as the healthcare system is tested. And in many ways, and in some ways, all our systems are being found wanting. And all of them need a level of repair and renewal. We need to go about doing that as we go through this pandemic as well.
And if I could just add to that, so there's different types of data that's collected, and Mike talked a lot about the case-based data that's coming from countries, but there's other types of data collection that comes through studies, that comes through epidemiologic studies, through clinical studies, through laboratory investigations, through treatment studies, through looking at how many lab tests are actually done and what is the % positive, to seroepidemiologic data, to anthropological data, through social science data. And as Mike said, we don't need this in every single country at all times. If there are some locations that aren't as overwhelmed as other countries, if they can do a well-characterized study of looking at healthcare worker infections, for example, who could look at disease severity, who could look at infection in children, these pieces of information from these characterized and conducted studies could really help inform the response. And it feeds into this feedback loop of helping us look at, are we doing the right things? How do we need to tailor this approach based on what we learn about underlying conditions, treatment options? How do we prevent people from progressing to severe disease? So there are countries that could carry out these studies, and they are, and these studies are ongoing. This is why we are constantly looking at the pre-publication papers that are coming to us through the journals, that are coming to us directly from scientists, and constantly looking at the papers that are being published, because all of that, in addition to us talking to clinicians and social scientists and laboratorians, all of that feeds into our guidance materials, into the advice that we're providing to all member states.
Thank you very much. Next question is from NHK. Shoko, can you hear us?
Hi, Tarek. Can you hear me?
Yes, please go ahead.
Okay, so I think my question is to Dr. Ryan. So this is about Japan. Since the first confirmed case was reported in the beginning of January in Japan, the number of newly confirmed cases were quite stable for about 2 months. But since the beginning of April, we see a rapid increase of confirmed cases. How do you analyze the situation in Japan and perhaps other countries in Asia while the center of the pandemic is still in Europe? Thank you.
Yeah, I think Japan, in fact, we had some very excellent data from Japan on their approach over the last number of months. And Japan has done a very, very good job over months, and it's taken an approach of very systematic investigation of clusters. In fact, I think they call many of their teams the cluster busters. They have these very specialized teams that have been going out and investigating clusters. And not only have they been able to contain those clusters, but they've gained a lot of tremendously useful information on how the disease spreads. So, for example, in those cluster investigations, they've determined that only 1 in 5 people actually spread the infection further. 80% of people don't spread the infection further in these cluster investigations, which means there's a particular